tomorrow. We are live in the Trustmark studios, the Gallo Show on SuperTalk, Mississippi, and that is on the road today, where your hometown Trustmark team is always there to help turn your plans into reality. People you trust, advice that works. Member FDIC. Karla Tye joins us. She is the executive director for Children's Advocacy Centers of Mississippi. Good morning.
Good morning.
Thanks for getting up early with us.
Absolutely. Thanks for having me.
Yeah, absolutely. This is, I think, an important day because we got a lot of ground to talk about, a lot of ground to cover over the next few hours. So let's just kind of start by laying the foundation. Children's Advocacy Centers of Mississippi, what is this?
Sure. So the Children's Advocacy Centers of Mississippi is a statewide organization that provides support, training, finances to child advocacy centers across the state. So we have 11 child advocacy centers all the way from South Haven down to Hancock County and Waveland. And those child advocacy centers spring into action after there's been an allegation of felony-level child abuse. So we're talking about all sexual abuse, severe physical abuse, witnessing a violent crime. And children are brought to those centers for a forensic interview. They are interviewed in a way that is non-leading, non-suggestive, but interviews them about the abusive allegation. And we do it with a multidisciplinary team. So social workers, law enforcement, all of those agencies that would get involved whenever there's a child abuse case, so that we're working in the best interest of a child. We're doing it in a way that it doesn't re-traumatize those children. Yeah. And then there are a lot of supportive services that happen after that interview, whether it be victim advocacy, mental health services, referrals for the proper forensic medical exams. So child advocacy centers are really crucial to the healing for children after there's been an allegation of abuse. They just do amazing work, and last year they saw 8,837 children.
Oh, wow. It's just a huge number, and it's a larger number. You wish the number wasn't that big. We're thankful that the resources are there to help. You wish that this problem could go away, but it is, I suppose, a reality. So last spring and a couple of times we've been at Sally Kate Winters in West Point. Is that one of the 11 sites that you were talking about across the state? They are.
They are a fantastic child advocacy center, and they provide all of those services that I just mentioned.
Yeah, and I mentioned that because I feel like some of our listeners perhaps can be like, okay, I get how all of this fits together. So the organization oversees those 11 centers, but isn't a lot of this about education and teaching and helping, I guess, ultimately staff those places?
So our role is really about making sure at the Children's Advocacy Centers in Mississippi. So these are our 11 member centers. We provide a lot of support to them. But as an organization, we also want to transform the system. Yeah. We are working with our state leaders. We are working with our policymakers, with state agencies that intervene. I mean, as I say, there are a lot of agencies that spring into action when you talk about a child abuse case. So at the state chapter, which is what we often call ourselves, Children's Advocacy Centers of Mississippi, we are working on policy that will impact children's lives. We're looking at how do we educate our future workforce, which I know is much of what we're going to talk about today, as well as providing the support to frontline professionals, whether that be at our child advocacy centers or the law enforcement, the boots on the ground that are doing the work every day.
So it feels like in Mississippi has been a little cutting edge in terms of who all is involved, because all of the public universities in Mississippi have been equipped with the tools that they need to deal with some of these things, and some have taken it a step farther in terms of how they are implementing it and kind of the educational process. But to have all of the public universities to some degree or another on board makes Mississippi a little unique, doesn't it?
It does. So back in 2015, we recognized that we were just seeing a lot of turnover. This has been going on long before then, but we sat down, we talked about it with the Attorney General's office, with the leadership of Child Protective Services, and said, we've got to do something because there's so much turnover, and that directly impacts the healing for children. It directly impacts
because they need stability.
They need stability, but you also need a workforce that knows how to investigate a case. They know how to prosecute a case. You have teachers that know when a child is showing signs of abuse, what those signs and symptoms are, and then how to make a mandated report. And what we realize is our professionals didn't have that preparation. And so our 3 agencies got together and talked about it and said, how do we solve this problem?
We will continue our conversation with Karla Tye. We'll talk a little bit about what is involved when you think about all of the different government agencies who've got to work together. Getting all the government agencies on the same page to do anything, that's impressive if that can be accomplished. Maybe a little easier here in the state of Mississippi than it is in Washington. We'll also touch on the education piece with teachers and them recognizing the signs there. That's when we come back for the start of the 7 o'clock hour. Got news coming up next from both Fox News and SuperTalk Mississippi News. 7 o'clock hour. Just getting out of bed? Good morning. Glad to be with you. This is the Gallo Show on Super.